13
or
is
14?
when we're.
Yeah, it was just sort of, it was a good story here to here, so it's fine.
Hold on. She knows. Oh, there
There we go.
it is.
And make sure you laugh again.
So we had the
Support for Carolina Business Review provided by Grant Thornton. Operating in more than 100 countries, our tax, audit, and advisory professionals specialize in helping companies unlock their growth potential. Blue Cross and Blue Shield of South Carolina, where healthcare is changing for the better. Find out how at ahealthysc.tv. And by Sunoco, a global manufacturer of consumer and industrial packaging products and provider of packaging services, with more than 300 operations in 35 countries.
For centuries, we've exchanged currency across borders and sent students abroad for cultural exchange programs. There's the stock exchange, retail exchanges, food exchanges, and even phone exchanges. But today, there's only one exchange on the minds of many. Welcome, and thank you for tuning into the most widely watched program on Carolina business and public policy. I'm Dr. Cheryl Richards, filling in for Chris William. And on today's show, our panelists will exchange their thoughts on our new health insurance marketplace. From ideas to laws, from providers to payers, and technology platforms to governmental reform, it's all on the table. Let's turn now to our guests for an invigorating exchange of dialogue on our newest exchange in healthcare.
Major funding also by Novant Health, bringing you world-class technology, clinicians, and care when and where you need it. The Duke Endowment, a private foundation enriching communities in the Carolinas through higher education, healthcare, rural churches, and children's services. And by Blue Cross and Blue Shield of North Carolina. Who's responsible for rising healthcare costs? Join us and many others in a candid discussion at letstalkcost.com. This edition of Carolina Business Review was recorded October 25th, 2013. On this week's program, Mark Hall of Wake Forest University, Ashley Landess of the South Carolina Policy Council, and John Supra of the South Carolina Department of Health and Human Services.
Welcome, everyone. Thank you for joining us today.
Great. Thank you.
Who's going to kick us off with the first exchange of dialogue? Whatever. So let's talk about it. Where do you think we are? What's the current status of our federally imposed here exchange?
Well, it's a mixed bag. It got off to a rocky start the first few weeks, and they're still trying to make the website work smoothly. But prior to that, things really took shape well, I think, because there was good participation in most states by insurance companies, and the rates came in really quite moderate. I don't know, it's hard to say anything is low, but they came in lower than expected, and I think it arranged that a lot of people are going to be able to afford and find, pleasingly advantageous to what they've seen before.
Mm-hmm. What do you think? What's your assessment, Ashley, of the exchanges so far?
Well, first of all, it's a little hard to tell, isn't it? We've had a few glitches going into it, so I would caution against kind of observing a trend this early. One thing we do know, this program is completely untested. There is so much unpredictability about this that we don't know much. We do know, and this was reported a couple of days ago, that already we're seeing that the rates were maybe a little bit off in some areas. So they kind of lumped people into two broad categories, and that got a little bit confusing. I just think it's hard to tell anything at this point.
Well, I think that we understand that there are some glitches, but I think we have to look deeper as we start on the technology side to say, we're not having trouble with people logging in and getting through the process. but there's a lot of back-end work that we don't know what's going to happen. And I think the notion of uncertainty, not reading too much into the early trends, but really it's going to take some time for us to understand how we move this forward. And I think we are going to see rate increases. And in South Carolina, our Department of Insurance estimated as much as 50 to 60% rate increases in our individual market.
So let's talk about those increases then, and kind of the access, because the whole intent behind this is to provide access, right, for an insurance. So where do you think that's going to fall?
Well, I think let's talk about the word access there. I think one of the challenges with the Affordable Care Act really lies in the fact that giving people insurance coverage equals access to services, and ultimately I think equals good health outcomes. And I think that's a fallacy.
Absolutely.
And I think the challenges that we need to really be focused on as we critique what's happened and where we are how do we start to break that fallacy apart and focus on health outcomes.
And I want to add to that, if I could quickly. I think that's exactly right. If you look at the goal of the Affordable Care Act, it wasn't health care, it was to provide insurance. And that's a very different thing.
Let me speak to the access point, though. I mean, it's true that having insurance doesn't necessarily guarantee good outcomes, but I think everyone agrees that people are much better off with insurance than without it. It's much easier to get a doctor, to get a hospital to accept you if you have the insurance than if you don't. And we assume that the medical system is going to provide life-saving care and relief of pain and disability. So. Undoubtedly, people's lives will be greatly improved. Now, whether it will function at the level that we hope it will, whether there is room for improvement, undoubtedly there's a great deal of room for improvement. But just giving this opportunity to the tens of millions of people that have no access, some access, is I think, a major achievement.
So let's talk about the access a little bit more. So one assumes that technology becomes a vehicle for access, and we know we have had a less than perfect launch in a website to begin with. What are the other distribution points and access points of getting the word out to individuals, or maybe not in that population, some of our most vulnerable populations?
Yeah. Well, insurance agents are paid to sign people up. You can also call an 800 number. You can meet with in-person enrollment counselors at a variety of different locations. Even the major insurance companies, the Blue Cross plans, have retail outlets at certain strategic locations. You can walk in at a shopping center or a mall or what have you and get advice. So I think there's going to be multiple different points of access. I think even healthcare providers, hospitals, I think will have ways to get people signed up. Once the sign-up process starts to work more smoothly, I think we have to remember, I think it was only 6 or 7 years ago when Medicare expanded to cover prescription drugs. There was a similar process of going online to sign up, and that was bumpy as well. But after a number of months, they worked it out, and the Medicare prescription drug program is working quite well, and I think the process of signing up is going to vastly improve. But where you go to get this advice, it's not an easy decision to make. You really need to sit down and talk with somebody, and that involves more than just a website. I think that in-person, one-on-one assistance is going to be critical.
And I think, though, I want to go back to the notion of the access equaling the insurance. We talk about the most vulnerable populations, the populations we serve within the Medicaid program. We have in South Carolina estimated over 200,000 people who are currently eligible for our program and not enrolled for a variety of reasons. So the question is, how do we start to reach those vulnerable populations? And if the goal of the Affordable Care Act is to reach those populations through very traditional insurance models, insurance is something that works well for those people that understand it, sign up for it, participate in it. We need to reach out in other ways, we believe, for those people that are most vulnerable.
Well, look, again, and I'm just going to take this back to the larger point here. Suppose the process goes perfectly and everyone gets signed up. Does that necessarily mean, as John's pointed out, that we have better outcomes? I think not. If we got everybody signed up for this, what we do know is going to happen is rates are going to increase. The Obamacare system looks good now. The Affordable Care Act says affordable, right? Everything's going to be cheaper. But here's what we know. Already in the private insurance sector, rates are going up. already before it's even been fully implemented. So I think the idea that insurance is or should be a goal or should even be the conversation, I don't agree necessarily that having insurance means that people are healthier and happier. I think the insurance model is flawed. It's already been messed up by meddling politicians, and having insurance does not equal having quality health care anymore, if it ever did.
Mark, what do you think?
Well, I'm a bit surprised to hear, are you going to give up your insurance? I guess I wonder.
Well, look, I'll tell you what,
if it's a bad idea.
I have a
let's-
feeling
let's
that might
all-
happen regardless of
let's all
whether I want it to.
Put our cell phones on the table or put our insurance policies.
It
on
might
the
happen
table.
regardless of whether I want it to, but you know, again, you've got the middleman now so in charge of healthcare. You do not have the doctor-patient relationship being that protected anymore. Now there's this third party, and really the larger party in charge of healthcare now is not even the insurance companies; it's the politicians.
Mark?
I just think that's an exaggeration, but all due respect, I mean, I take this sort of debate back 15 or 18 years ago when President Clinton was pushing forward a different plan, and it never even got to a vote because of some of these same concerns. And so when it failed, then what we got was managed care, you know, the denial of care, the restriction of access that was sort of produced by the competition of for-profit, you know, insurance companies. So I don't think that somehow the private sector is this sort of pure, unblemished, you know, sort of Garden of Eden where, you know, you walk in and get all the care you need, and the government is going to come in and somehow mess that up. It's a complicated interaction of imperfect systems, and it comes back to the question: is are people better off with insurance or without? And
Well,
So John, let me ask
change-
you, I'm going to switch
Oh,
gears
that's
for you
okay.
right there.
We could go on
Sorry.
this all day.
We could take up an entire show on this topic
Right.
here. So what do you think? Do you think the ACA is going to serve as a catalyst for reform in general?
Well, I want to connect what we were talking about, I think, with that question. And I think the important thing to look at, and another consideration, when you talk about a catalyst for reform in general, I think it comes down to the question of, is the ACA or any of the reforms that are currently being pushed either at the federal level or in a broad level across the system, are they actually driving innovation in the system? Or are they moving the same amount of dollars into another area? And I think what this really suggests to us is we're equating our health of our communities and our citizens to access to health services. We know, often referred to as the social determinants of health, that really about somewhere between 10 and 20% of our overall health is related to those services. The other includes education, employment, food security, and when those other systems that people rely on aren't being spent on because these same dollars are being put into health or health services, we're not making the best investments. And these are trade-offs. And as we've talked to particularly businesses and small businesses in South Carolina, every dollar that goes into the health system is not a dollar that's going into wages, it's not a dollar going into manufacturing or research and development. And that's a choice that we're making either directly or indirectly.
So let me pick up on that because I think it's important to mention, you know, the South Carolina Chamber has been fairly vocal around small business and the impact of small business and making changes themselves to employer-based benefits. We know the corporations get a one-year waiver in this. So where do we think this hits the small businesses?
Well, hard. The answer is hard, but it hits all businesses. It hits small organizations, even a nonprofit like ours. It's definitely going to hit us, but it certainly hits, you know, more than 2,000 businesses in South Carolina. They have to make some extremely tough choices. Do they pay the mandate? Do they, you know, end up paying? And they will eventually. One quick point about insurance. Remember, the idea of insurance is a catastrophic notion, right? It's about whether or not you're covered if something catastrophic happens. It shouldn't be about managing health care. That should stay between the doctor and the patient. I feel like that's an important point. I really think
I think you bring up a good point, but I do think your point, Mark, on insurance for preventative care is a very valid point.
Well, so preventative care is one good example of where having it paid for will encourage people to come in earlier and get better care. So I guess I'm still sort of stunned on the sort of basic premise that somehow insurance is bad for you.
Well,
I just don't quite
Don't-
see
Not quite
where
that
that
far.
sentiment is coming from, but to sort of move beyond that to sort of the impact on small businesses. So it's just not true that small businesses are required to meet any kind of mandate. They're given the smaller ones with lower wages are given a tax credit, which is available. Not a great number have taken that up, but otherwise they're left to do exactly what they want, just as they were before. So the requirement on businesses really that is suspended for a year applies to larger businesses, and most of them, 85, 90%, cover their workers, or 85 or 90% of those workers are covered. But some will face this choice as to whether their workers are better going to the exchange and getting the government subsidy, or whether it's better for the employer to continue to provide this for the workforce. And some employers are kind of splitting the difference. They're going to what were called private exchanges that are unsubsidized exchanges because they like the idea of giving the worker the choice of the plan or policy and providing the money and then letting them pick. So in a sense, I mean, what we're seeing with the marketplace exchange is just sort of a government version of what large firm employees already have, but now it's provided to individual workers. I mean, individuals who don't work for large companies, or for freelance workers, or for people whose employer doesn't provide the same benefits.
But how big is it? You know, when you think about a business of 50 people, think about the decisions that this is going to push, right? Who's going to hire that 50th employee when it shoots up the cost and they have to take on the whole mandate? What about going from the full-time workers to more part-time workers? We don't just think that might happen. We know that it's happening. It's already happening. Yeah. So you have that problem on the table. And I think you're going to see a huge impact. I'm going to tell you one story that's very real about a South Carolina business. Family business, been there for generations. It wasn't just the cost so much as it was the unpredictability. Nobody could tell this business person how much it was going to cost to insure, you know, the employees. And the unpredictability of that is what's really driving a lot of businesses into that tough place. And a lot of us up here, listen, us included, we'd all love to say we can predict that, but we can't. The unpredictability for business, and as well as the mandates, who's going to expand business when it might come with a $500,000 increase in cost?
The real question, I think, in the short term is we're coming out of an economic downturn, hopefully towards more recovery. The uncertainty for business about what is going to happen, not just with the law, but to costs in general, it makes them hesitant to expand business,
right,
to gain employees at this point, to invest in R&D, and ultimately makes us less competitive.
No doubt.
Let me sort of give a counterpoint, and I can see how the dynamic's going to go. You're going to say negative things, and I'm going to say positive things.
I will find something we could say positive
this
together.
Is the best
I
possible,
probably won't, but you guys go ahead.
I don't think this is the best possible law that you know, the imagination, the human imagination can dream up. But it's in our imperfect system, the law that we have, and so I will take it as my role in the time we have to point out some of the good features. So, on the business side, one of the advantages of the Affordable Care Act, which eliminates the idea of people ever being uninsurable. So it does not insure everybody, but it makes everyone universally insurable, which means you can get in and get coverage when you need it. And that what that means is that people can free themselves up from being locked into the same job. Right now, people are afraid to leave jobs with benefits because what if something bad happens and they get a condition, even as small as asthma or the hiccups. I don't know what, you know, what insurance companies will exclude you for nowadays that would keep them out of the insurance pool. But with the Affordable Care Act, you have this freedom to take chances, and chances is what sort of American entrepreneurship is all about. This is how small businesses get started. People say, I'm leaving the big firm where I've got my skill set, but I'm bored to death or I feel unfulfilled, and start my own company. Now they know they can get the coverage, that they're not going to be sort of priced out or excluded or underwritten out of the system. And so labor economists have done studies projecting what that sort of relief of that concern will mean, and they predict a significant increase in entrepreneurship as a result.
That's a very interesting point, I think, as we're talking about small business. John, I'm going to turn the next question to you, and let me say, let's talk about the impact of this on Medicaid.
In the broadest sense?
Broadest sense.
Well, I mean, the impact on Medicaid, I think everyone's aware the Supreme Court gave states the option to expand their Medicaid program. South Carolina, we chose not to do that. And the basis for our decisions on the Medicaid side are that we're not meeting the commitments in our current program. As I said earlier, we know that we have probably around 200,000 people eligible but not enrolled in our program today. How do we go about first meeting those current commitments? And then as we look forward and we look at Medicaid as a program, it's generally not flexible in its benefit design. It doesn't give us at the state level the opportunities to drive outcomes towards the benefit design. So we actually think there are better ways to, at a lower cost, provide better health outcomes over time.
Interesting. So, Mark, let me give you this question and kind of throw it in a broad context as well and say, you know, we think about the hospitals who will now be faced with some of the rights, responsibilities, and burdens of kind of managing this with Medicaid. What do you think the impact of that is on the hospital system?
Well, hospitals are trying to find their footing as well. I mean, Ashley's certainly right that there's a lot of uncertainty how it's all going to play out, and I think a lot of it is because we've been told that the sky is falling and the sky isn't actually falling. But I think on the plus side, states that did expand Medicaid, hospitals for most part are going to be in better shape because they have been treating a lot of uninsured people, and those numbers will be reduced in about half. Now that reduction of uninsured, about half of that will be going on to Medicaid, which does not pay as well as private insurance. For reasons that we all understand, and we wish we could do better, but hospitals are required to take these people regardless. So, but getting 80 cents on the dollar is a lot better than getting 2 cents on the dollar, and so the hospitals in states with expanded Medicaid, I think, are feeling okay about things. I think in other states like North Carolina and South Carolina, we've seen some hospitals close. We've seen some hospitals with really pretty massive layoffs. And I think in large part that's because at the same time their Medicaid programs are not expanding, they're losing some of the federal funds that they used to receive to treat the uninsured. So they're getting sort of hit with this double whammy, and I think that's going to be a difficult time for them.
It's kind of a conundrum, isn't it? I mean, you get layoffs in hospitals and you get 30 million more Americans who are going to find their way to insurance, right?
That's right. And I think you see a pattern where those layoffs are happening more in states that did not expand their Medicaid than those that did.
Well, if I could just make a really practical point and remind everyone of this, and this is one of those things we don't like to kind of say out loud a lot, but let's be clear, all of those federal dollars, or many of those federal dollars, it's debt. So we don't even really have a sustainable system to begin with. As lofty as all of this sounds, we can't afford all of this with current dollars. We don't have the money to pay for it. So when you think about 45 cents on the dollar coming into our state and that money being from debt, now you start to see where the problems come in. Most of the hospitals in South Carolina are government subsidized, and in fact, practically government entities anyway. Wouldn't you say that's becoming more and more true, John?
I don't know.
All right, I'll go ahead and answer. It is true. And so the hospitals have been a big driver of wanting Medicaid expansion because they want this round of dollars. But I'm going to take it back to a quick big picture thing. Is health care better today with progressively more intervention from politicians than it was before? Is it better today? And will it be better 5 years from now? I'm pretty sure not.
Mark, would you like to comment on that?
Well, I'd be happy to comment. I mean, there's a number of points. One is, there's just a lot of misinformation out there, and one of them is that somehow the Affordable Care Act increases the national debt. It doesn't. The Congressional Budget Office and all the neutral and non-political evaluators say that it actually slightly reduces the debt because it finds revenue sources that pay for all the expenses. Once the insurance premiums came in at lower than projected, and once about half the states did not expand Medicaid, the Affordable Care Act is going to cost even less than it was originally projected, yet all the revenue sources are still there. So it's actually going to help reduce the deficit.
Well,
there's plenty of
come on, Mark.
No, it's true. I mean, you're just making things up. If you look at the evaluation, now it's true we have an awful lot of debt, and we could reduce that debt more if we had more of a surplus in other areas. And so it is taking money that could be spent on one thing and spending it on this. That is always the truth in terms of any dollar spent. It can't be spent on something else. But the program does pay for itself. And so then the question is government sort of messing up health care. I mean, this was the line that the American Medical Association used, that others used to oppose Medicare. Medicare is the federal government program for the elderly, and it is the most successful, most well-liked insurance program in the country. If you poll people and say, do you like your insurance, people on Medicare consistently vote stronger with their ratings than any other kind of private insurance. So the government can run a good insurance program. Now,
I'm going to have to stop you right there. I know it's like a controversial statement, but what do we do? We leave it on a controversial statement. We got to wrap it up here.
Okay, wrap it up.
And we'll bring you on for another round of this to say, is it a good thing, right? Thank each of you for coming today. We really appreciate your perspective. I can guarantee that the dialogue exchange will continue much beyond this program today. So thank you for being here.
Thank you so much.
Thank you.
Really
Great.
appreciate it.
Great discussion. Great exchange.
Great exchange.
Very good exchange.
All of our information there on Carolina Business Review on the website. And thank you. Appreciate your perspectives today.
Major funding for Carolina Business Review was provided by the Duke Endowment, a private foundation enriching communities in the Carolinas through higher education, healthcare, rural churches, and children's services. Blue Cross and Blue Shield of North Carolina. Who's responsible for rising healthcare costs? Join us and many others in a candid discussion at letstalkcost.com. Grant Thornton. Operating in more than 100 countries, our tax, audit, and advisory professionals specialize in helping companies unlock their growth potential. Novant Health, bringing you world-class technology, clinicians, and care, when and where you need it. Sunoco, a global manufacturer of consumer and industrial packaging products and provider of packaging services, with more than 300 operations in 35 countries. Blue Cross and Blue Shield of South Carolina, where healthcare is changing for the better. Find out how at ahealthysc.tv. And by viewers like you. Thank you. Promotional consideration provided by Business North Carolina Magazine. For more information, visit carolinabusinessreview.com.